Thank you for staying with us on Channels Television. It's nice to have you with us as we switch gear to talking health matters. I'm Yomi Otaigbe. Today, our attention is on anemia, which is a public health challenge that affects a population in both the rich and poor countries. What does it mean to be anemic? These and other questions I'll be putting to our guests on the program. A physician and medical director of Isolo Estate Clinic, Dr. Olatunde Olusumade. Thank you so much for being with us.
It's a pleasure.
Yeah, it's nice to have you. So, what does it mean to be anemic?
Anemia is a clinical state that recognizes an inadequate level of circulating red blood cells in circulating blood or inadequate level of hemoglobin in blood. Okay,
so maybe you should just break it down for us. Inadequate red blood cell in circulating blood.
Okay, to give you a background about all this issue about anemia, I would like to start by saying that all the tissues of the body require a constant supply of oxygen at the same time. It is circulating blood that meets these requirements in a way that, if I can give an example, the brain cannot do without oxygen for more than 2 minutes. Consciousness is lost. The muscle cannot do without oxygen for more than 2 hours. So that tells you that absence of oxygen is incompatible with life. Now, the part of the body that subserves constant supply of oxygen to all the parts of the body is the red blood cells. That is why if you have a reduction in the number of red blood cells at the tissue level, the body will be starved of oxygen. What is responsible, again, for the transport of oxygen inside the red blood cells are the hemoglobins. And the hemoglobins constitute about 1/3 of the volume of the red blood cells. So what I'm saying is that if the red blood cells are less, what it means that the total circulating hemoglobins are also reduced because the relationship between them are directly proportional. Okay. The other aspect I'll quickly say is that blood is seen to be red because it contains a lot of red blood cells. There are also other cellular components like the white blood cells and the platelets, but predominantly it is populated by red blood cells, and the redness is as a result of that red pigment that I am calling hemoglobin. I should also quickly add that red blood cells are manufactured in the bone marrow by the rate limiting step is also a small hormone called erythropoietin that is derived from the kidneys. I hope we'll talk about that later, the effect of the kidneys in anemia.
Okay, now you said inadequate red blood cell.
Yes.
What accounts for this inadequacy?
I said red blood cells are made in the bone marrow. So if anything is wrong in the process of making red blood cells, that will be a cause. We call it hemopoietic cause. Then when red blood cells are made and released into peripheral blood, their lifespan, because those red blood cells don't have nucleus, they cannot self-perpetuate, they cannot reproduce, they cannot divide. So when they are released, they have a lifespan. And that lifespan is average of 120 days. So if anything is wrong in the formation of the red blood cells, which is inherited, I hope we will get to it later, the red blood cells will not be able to live up to 120 days. The other aspect of it is there are also some intercurrent diseases that will not allow the red blood cells to live up to 120 days. They are hemolyzed, and that is what we call hemolytic anemia. The other aspect of it is all forms of blood loss, either acutely or slowly. We also deplete the person of blood, and of course, that is the third aspect of anemia.
Okay, and you said there is the issue of the blood not being produced as it should.
Problem with production.
Okay.
Yes.
And then problem with loss.
Yes.
Now, these problems you've mentioned, for instance, the genetic one that has to do with sickle cell, let's talk more about that for now.
If we are going to talk about problems of production in general, you see, it is good to talk about hemoglobin. Hemoglobin, I would like to try and be as simple as possible. Hemoglobin is a metalloprotein. That is, there is an aspect of it that is chemical. There is an aspect of it that is protein. The aspect of it that is protein is inheritable. That is where the issue of sickle cell anemia or sickle cell disease comes up. What happens is that there is an exchange of amino acid, glutamine for valine in beta chain. The protein part is alpha and beta. The problem with the beta chain is the one that we call hemoglobinopathies, sickle cell anemia, sickle cell. The one of the alpha chain is called thalassemia. It is good to mention it. It is rare a bit in this part of the world, but when you go to the Mediterranean, which includes some parts of Egypt and things like that, they have it. If it is inherited as an autosomal recessive, you have the disease. But if it is inherited as an autosomal dominant, that is a position that is not compatible with life. It will be impossible to make hemoglobin in the first place. And these are one of the problems that you have.
Okay, let's move over to at least the one that is more common, the cause of anemia in our environment. And you mentioned infection. Let's talk about the kind of infections that can bring about anemia.
Any infection that either primarily or secondarily infects blood, it leads to what we call intravascular hemolysis. I will group all of them by saying all infections that eventually become septicemia. That is a proliferation of pathogenic bacteria.
Septicemia meaning?
Septicemia means bacteria is present in blood and they are proliferating at a very fast rate. One of the ones, at least, that people will understand is typhoid septicemia. It's a severe form of septicemia. All other forms of acute bacterial septicemia, of course, they cause serious intravascular hemolysis and rapid anemia. It is good to quickly mention that anemia is actually the commonest disease that affects blood, and that iron deficiency anemia is the commonest cause of anemia.
So how would you rate, the prevalence in our country?
Well, we are operating in an environment where there are no statistics. But if you take a comparative analysis of the US, where you have iron deficiency anemia or anemia prevalent up to 25 to 30% of that population, you can extrapolate that if a study is done, you will probably find anemia in more than 50% of the population here.
And so this is something that, we should really look into and perhaps worry about a bit, because if we look at the complications from anemia itself, then it is not what we should look away from.
Yes, anemia contributes a lot. There are no figures to morbidity and mortality in all age groups, most especially the very young and pregnant women.
Okay, now, aside from, I know that sometimes if somebody is said to be anemic, the person may be feeling some kind of fatigue, and, what are the other things that one can look out for and say, okay, perhaps this could be anemia?
In terms of the symptoms, most people complain of tiredness. They are tired right from the morning throughout the day. And as the severity of the anemia progresses, they complain of dizziness. Some of them complain of lethargy. Some of them complain of inability to concentrate. Some of them complain of problems with retentive memory, depending on the severity of anemia. Then some of them begin to have hemodynamic abnormalities. When the blood concentration of hemoglobin gets to a particular level, the heart begins to beat at a rate that is faster. It begins to beat forcefully. Some of them complain of palpitation, and when you look at people that are anemic, one of the things you will see is that they appear pale. Their mucous membranes are very pale. Then you might also see some signs of the causes of anemia. You know, you see people that are exhibiting jaundice, you know. At times you see people with petechial hemorrhages on their skin, people with bleeding abnormalities. Some people even complain that they bruise easily, you know, and things. Those are the clinical
And
features.
then sometimes, you know, you look into people's the eyes and you see it's like
very pale.
Yeah.
That's the classical way.
Okay, we'll talk
Yeah.
about how to you know, go about managing this anemia, but let's look at anemia in pregnancy, because you find that because of the course of pregnancy in a woman, then a whole lot of things happen.
Anemia in pregnancy is one of the major obstetric problems that we have in third world countries, because under normal circumstances, you expect the blood volume in pregnancy to increase by 60%. You expect hemoglobin concentration in pregnancy, in the whole course of pregnancy, to increase by 40%. What that does, actually physiologically, is a slight dilution of the blood of a pregnant woman. But how is he going to achieve a 40% increase? It is supposed to be from dietary iron. But unfortunately, some people don't get enough iron. Then they are also supposed to get supplemental iron, but their exposure to access to antenatal services, if you look at Nigeria, just about 10, 15, 20% of pregnant women have access to antenatal services. Then the issue of determination of the state of anemia. You know, a lot of people go through pregnancy anemic, and the process of pregnancy and delivery, the slightest complication of excessive bleeding leads to mortality. So these are some of the problems that our pregnant women face in the course of their pregnancy and delivery.
And the effect on the baby in the womb?
The effect on the baby is to be understood. There is something they call intrauterine growth retardation. If the baby is not getting enough oxygen from the blood of the mother, because the blood is inadequate, the rate of growth is reduced. The possibility of having what is called intrauterine death is very high.
It's very high.
The pregnancy can just terminate. Then the other complications will begin to set in.
Okay, we really need to talk about how to deal with this. But right now we have the picture showing on the screen, showing this is how white it can be.
Yes, this is a bad